Hi, my name is Bobbi Pineda, and I'm here to tell you a little bit about the NICU Therapy Lab. First, a little bit about me. I graduated with a bachelor's in occupational therapy in 1992. I first entered practice into pediatrics, and probably by around my third year, transitioned into the neonatal intensive care unit at a children's hospital. I entered into the NICU with a mentor, and so it kind of like started a little bit slowly. And then once I gained more and more experience, I was pulled in more and more. I continued to work in the NICU until about my 12th year. And then also in that time, I had two prematurely born children. And so my son was born at 29 weeks estimated gestational age, so more than 2.5 months early. He was hospitalized at Duke Children's Hospital for 5 weeks. And then my last child, a daughter, was born at 35 weeks, estimated gestational age, and she was hospitalized in the special care nursery for 4 days. So I have the experience both as a clinician, as an occupational therapist, where I evaluated and treated high-risk infants in the NICU, and then I also have the experience as a parent within the NICU setting. It was actually my parenting experiences that drove me to want to change from being a clinician to doing research where I could make a difference in terms of impacting the neurodevelopmental outcomes of high-risk infants that have a stay in the NICU. And so in 2006, I finished my PhD. And since that time, I've only done clinical research. So I started out at Washington University, where I was for about 12 or 13 years. And then I've been at USC since February of 2020. In our research lab, we have several different areas of focus. So the first one, which is probably where we spend most of our time, is looking at the early sensory environment. Within this, we know that high-risk infants receive a lot of noxious stimuli within the NICU environment, so a lot of altered sensory experiences. They also have very immature brains that can't quite tolerate the sound and lights and all the different sensory exposures that are happening, making them kind of have increased vulnerability. And then on top of it, parents have a more difficult time being able to interact and nurture their high-risk infant in the NICU because of tubes and wires and incubators and also their medical fragility. So that limited interaction also alters the early sensory environment. So we study different factors, predominantly those that are modifiable that can help to improve neurodevelopmental outcomes. One of our big things that we've done in our lab is develop the SENSE program. And the SENSE program is the Supporting and Enhancing NICU Sensory Experiences program. It has gained a lot of traction over the years. There are now over 500 hospitals in the United States and abroad that have implemented the SENSE program. And within that, we're able to study kind of a optimized sensory environment compared to standard of care, as well as study implementation of the SENSE program across different hospitals. Another area of focus for our lab is looking at health service delivery for high-risk infants and their families. There's great variability in terms of occupational therapy, physical therapy, and speech language pathology services within a NICU setting. So one hospital can be very, very different from another hospital. And then also, as infants transition from the NICU to their home, the continuity in terms of early intervention services or early therapy services can be quite challenging. One of the things that we've developed within our lab is called the Baby Bridge program that helps to provide continuous and consistent therapy services once a baby is discharged until other community-based services pick up for the infant. That's called the Baby Bridge program, and so we study a lot of that as well. Another thing that we study within our lab is looking at modifiable factors that can impact outcomes. And so first, just trying to understand what kinds of factors are related to poor neurodevelopmental outcomes, whether those are medical factors, social factors, or those modifiable things that are happening within the NICU, such as whether a baby is breastfed or bottle fed, whether the parent is able to be there and actively engage with the infant, and what kinds of interactions they do with their infant. So we look a lot at those kind of environmental modifiable things that occur that can impact outcomes. And then finally, we look at early oral feeding. And so when babies are born preterm, they are not able to orally feed. Their central nervous system is too immature in order to coordinate, suck, swallow, and breathe in order for them to be able to be successful. And many times they're so fragile and vulnerable that their gastrointestinal system can't tolerate gastric feeds either. During that time from preterm birth to term, however, things evolve. Central nervous system maturity happens, and babies are able to, most of the time, be able to successfully orally feed by the time that they get close to term equivalent age, and then are discharged. And so we look at different kinds of interventions that help to support that early developmental trajectory. We also look at different factors that can impact oral motor skills. And then we in our lab have developed the neonatal eating outcome assessment. So we use that as an outcome measure in a lot of our studies, but then also study its psychometrics. There are a lot of different factors that we collect as part of our cohorts, and each cohort is a little bit different, but I'll tell you just a little bit in general in terms of the cohorts that we collect data on. So typically we enroll infants that are born preterm, and so usually they're very low birth weight, so less than 32 weeks estimated gestational age, so at least 2 months early. Typically we enroll them within 1 week of life. And then we follow them throughout their NICU stay, and then many times after they're discharged from the NICU. I think our oldest cohort is now 14, and we have some time points that we've collected all the way up until age 12 on them. Most of our studies are observational, where we track them over a long period of time. Sometimes there can be an intervention where we compare, for example, the SENSE program to standard of care. And we look at developmental outcomes related to an enhanced sensory environment versus not. We also might do interventions such as an innovative bottle system compared to traditional oral feeding practices. And then during these studies, we oftentimes collect multiple different outcome measures. And maybe it's not necessarily the outcome of interest, but we collect this information because there's a lot of different confounding variables. Those confounding variables can include medical factors because each infant has their own medical course that they have during hospitalization. We also collect information on neurobehavioral performance at term equivalent age, typically using standardized assessments. And within our cohorts, it's usually a member of the research team that will go to the NICU bedside and do those assessments. And then we also collect a lot of information related to the family. And so usually those are our parent report measures of stress, anxiety, depression, confidence, and then also parental role alteration. And then many of these infants will follow after discharge, and we look at things related to developmental outcome. So we'll look at language, cognitive, motor. We also might look at sensory processing or look at their social emotional health. In terms of our team, the team continues to change and morph with every year as students move on and new students join the team. But largely our team consists of a research coordinator, USC and non-USC students, as well as other support staff. The support staff usually aligned with funded work that we're doing and onboarded for a specific purpose related to each study. We also have collaborators in St. Louis, where our currently funded R01 work is going on, enrolling 215 babies. That team consists of a neonatologist, a couple of nurses that are research coordinators and research assistants, an occupational therapist, and then there's also other support staff for that group as well. We also have collaborators more locally here at Chalk as well as at CHLA. And within our, team, typically we have weekly team meetings, both with these other collaborators, for example, in St. Louis, as well as just with our USC team. We talk about all of the different moving parts of each study that's ongoing. We also have journal clubs and different learning sessions so we can learn and engage in different things related to topics of interest related to the NICU, as well as specific things related to understanding the data, for example, that we're collecting from the different cohorts. Let me tell you a little bit about different opportunities that we have. We have opportunities for volunteers. Typically, volunteers come on to the NICU Therapy Lab in order to acclimate to the research environment. They usually spend a lot of time just kind of learning about what we're doing by engaging in our weekly team meetings. And then they may contribute to ongoing projects in the lab, such as helping with data management, helping to prepare presentations, participating in literature reviews. And then also they might engage in other miscellaneous tasks as they arise related to specific projects. We also have current opportunities for OTD students, and I wanted to separate two different avenues out for this. So one is that there are opportunities specifically in St. Louis that allow hands-on experience with babies and families directly in the NICU as part of our clinical research. That is at Cardinal Glennon Children's Hospital, which is a level 4 unit, and then St. Mary's Hospital, which is a step-down unit, which is a little bit smaller. But students who engage in that opportunity have the ability to provide sensory-based interventions to infants in the NICU as part of our ongoing research study. However, we also have opportunities that are available from more of a hybrid standpoint or also here in LA. And that is where the student will choose a topic that our lab has data for, and then they're walked through the process of writing a scientific manuscript to submit for publication or come up with a draft that maybe is on its pathway towards publication. And again, that can be in LA or also via hybrid. We also have opportunities for PhD students where they can join the NICU Therapy Lab. There's a large experiential learning component where the PhD student functions as a research assistant for the NICU Therapy Lab and engages in a lot of different activities towards our ongoing projects. There's also opportunities for engagement in education and learning. And then the PhD student ultimately chooses a dissertation topic that aligns with the goals of the NICU Therapy Lab and receive mentorship along that pathway. We also have opportunities for postdoctoral fellows where they can have the opportunity to gain additional research experience. And typically, postdocs will engage a lot in authored publications. They may also engage in clinical research procedures depending on the projects that are ongoing. They do a lot of mentoring and delegating to other members of the lab, and then they also may take a strong role in grant writing as well. In terms of our lab and finding a good match for our lab, we find that students who are successful within our lab are those that are flexible and adaptable because there's like rapidly changing things that happen within the NICU Therapy Lab. So those students are really able to pivot between projects and then go back to things that they were previously working on can really be a strength. Also, students who have excellent time management and organizational skills are willing to work hard to grasp complicated material, are professional, confident, and team-minded, have passion, perseverance, and enthusiasm for the NICU and premature infants. And, I think if you truly have a passion for the NICU, it really helps to strengthen your experience within the NICU Therapy Lab because this is an advanced area of practice. And so the knowledge and everything has to kind of go beyond the foundational knowledge that you get as an entry-level student. It also can be really beneficial if you've taken the NICU electives and other NICU-related courses, or if you've invested additional time to, go and observe within the NICU setting so that you can become acclimated to it. We also find that students who are successful are motivated and self-directed and then have a strong desire to learn, gain clinical experiences in the NICU, and or have a research background or research aspirations. I hope that answered all of your questions, and please refer to our website for more information.